Hey everyone, and welcome. So just last week, I was chatting with a practice manager who literally lost thousands of dollars in revenue. Why? Because of a simple, tiny modifier mix-up on a virtual visit. Crazy, right? Well, if you're a medical coder, biller, practice manager, or an auditor, you know digital health is evolving at a breakneck pace. But the shifts coming to our coding rules in 2025? They are absolute game changers. Welcome to part 1 of our 15-part Masterclass Explainer series on Master 2025 Telemedicine Coding. I'm Harshal, and I'm so pumped to be your guide through this whole landscape. We're going to dissect, decode, and master every single rule you need to know to keep your practice compliant and your revenue cycle totally intact for the coming year. We've got a lot of ground to cover, so let's just jump right in. Okay, let's dive into our roadmap for today's explainer. We'll kick things off with a quick welcome, then tackle the real difference between telehealth and telemedicine. After that, we'll break down synchronous versus asynchronous modalities, run through some key 2025 takeaways, and finally, look ahead to what's coming in part 2.
Welcome to the Masterclass, laying the bedrock for 2025 coding.
Section 2, Telehealth versus Telemedicine, the broad umbrella versus the clinical subset.
Now, before we can even think about applying those new 2025 CBT modifiers or assigning place of service codes and later explainers, we absolutely have to nail down these core definitions because in the auditing world, terminology isn't just semantics. It's literally the difference between a paid claim and a costly denial. People use telehealth and telemedicine interchangeably all the time, but from a compliance standpoint, no, they are completely distinct concepts. Let's start with telehealth. I want you to think of telehealth as this massive overarching umbrella. It's a really broad term that encompasses all the digital technologies delivering health-related services and information. This means it includes a wide range of healthcare activities that go way beyond direct patient care. We're talking about the entire digital infrastructure that supports a modern practice. Yep, even those administrative scheduling systems we all love to troubleshoot.
To put that into perspective, let's look at some specific examples of telehealth services. This covers things like remote patient monitoring, or RPM, where patients are using devices at home to track health metrics like blood pressure and then sending that data back to their providers. It also covers mobile health, or mHealth. You know those apps that provide educational resources, reminders, or just general health guidance. Plus, it includes digital patient education tools and those administrative scheduling systems that keep the clinic running day to day. All of that is the telehealth umbrella.
But now look at how telemedicine narrows our focus. Telemedicine is strictly a clinical subset of telehealth. This term refers exclusively to the remote diagnosis and treatment of patients using telecommunications technology. Basically, think of telemedicine as the purely clinical side of the equation. If your provider is actively diagnosing, treating, or managing a patient-specific condition from afar, well, then you're dealing with telemedicine.
Let's look at telemedicine in action. You guys probably see these cross your desk every single day. We're talking about virtual consultations with a general practitioner over a video call, or follow-up care after a surgery where the doctor is assessing the patient's recovery. It even includes the remote evaluation of skin issues through secure messaging and uploaded photos. Do you see the difference here? We've completely moved away from those admin tools and stepped directly into the realm of a provider actively treating a patient.
Section 3. Synchronous versus asynchronous modalities. Real-time versus store and forward.
Okay, so now that we've separated the clinical from the non-clinical, we really need to look at exactly how these services are delivered to the patient. Why? Because the delivery modality heavily dictates your code selection. At the highest level, we are looking at 2 primary modalities. First, synchronous telehealth. This refers to real-time interactions that directly mirror traditional in-person visits. So both the provider and the patient absolutely must be present and interacting at the exact same moment. On the flip side, we have asynchronous telehealth. This involves non-real-time communication. It offers incredible flexibility because it happens at different times depending on convenience. Basically, it does not require both parties to be available at the same time.
When we put these two side by side, the differences are pretty stark. And honestly, keeping these straight is going to be a high-value tool for your compliance toolkit this year. Synchronous is your real-time live interaction. It gives you immediate feedback and diagnosis, which is perfect for acute symptoms where you just have to have that face-to-face connection via technology. Asynchronous, though, is your classic store and forward data sharing. The patient transmits data, and then the provider reviews it later at their convenience. This non-simultaneous transmission is super ideal for things like dermatology photos or those really detailed patient questionnaires.
Let's dig into those synchronous examples just a little bit more. We are talking about live video consultations, which, as you know, are heavily used in primary care and behavioral health. It's absolutely crucial for acute symptoms that require an immediate assessment. It's also highly effective for specialist referrals because it allows the specialist to speak directly with the patient to plan out a treatment. In fact, our source materials note that platforms like Basque Health prioritize these synchronous telehealth services precisely because they deliver the immediacy and personal connection that patients really need during a consult. It creates an experience that's about as close to an in-office visit as you can get digitally.
On the other hand, examples of asynchronous telehealth are all about maximizing efficiency without sacrificing patient care. For instance, a patient might record their symptoms in a video and send it in for evaluation. Or, dermatologists will frequently use that store and forward technology to assess skin conditions based on photos the patient submits. Another common one is when patients complete detailed medical questionnaires that providers review before issuing follow-up instructions. These asynchronous modalities allow providers to efficiently review non-urgent cases without the pressure of a live interaction. And the best part? It frees up their schedules to focus on acute patient needs during their live sessions.
Section 4. Key 2025 Takeaways. Let's do a rapid-fire summary.
We have covered a lot of foundational ground today, so let's zoom back out and lock in these 4 pillars before we even think about looking at a single CPT code. Ready? Number 1, telehealth is the broad digital health umbrella. Number 2, telemedicine is the specific clinical diagnosis and treatment subset beneath that umbrella. Number 3, synchronous means live real-time video or audio interactions. And number 4, asynchronous means non-real-time stored forward data review. I literally cannot stress this enough, guys. Confusing these terms in your documentation or code selection will absolutely lead to coding denials in 2025. You have to know exactly what service your provider actually performed.
So, with our terminology totally locked in, what's next for 2025? Well, definitions are just the start. The biggest hurdles practices are going to face this year aren't just about what services are provided, but where the patient and the provider are physically located when the service actually happens.
Section 5. What's next in Part 2? Originating and distant sites.
In our next explainer, we are diving into the most critical, time-sensitive regulatory shifts happening in the Medicare billing world. We're going to clearly define the originating site, meaning where the patient is located, and the distant site, which is where the provider is located. Most importantly, we're tackling the impending end of the COVID-19 public health emergency flexibilities. Seriously, mark your calendars right now. As of April 1st, 2025, geographic location restrictions and originating site requirements are returning in full force for non-behavioral and non-mental telehealth services. This is a massive compliance deadline, and we will break down exactly how to navigate it so your claims don't stall out this spring.
And that wraps up Part 1. If you found this breakdown helpful, please give us a like, subscribe, and follow this channel so you do not miss a single part of this comprehensive 15-part 2025 coding series. We're building your expertise piece by piece, and you definitely won't want to miss our deep dive into geographic restrictions in the next explainer.
As we wrap up today, I want you to ask yourself a question. If an auditor walked into your practice tomorrow, would your documentation clearly prove whether a visit was synchronous or asynchronous? The clock is ticking on these 2025 changes. Until next time, stay compliant, stay curious, and keep learning. Decode Healthcare with Harshal. See you in Part 2.